Mastering the nursing process and clinical judgment. Hello everyone, welcome back to Nursing in Me, where we make nursing concepts simple, clear, and practical. Today, we'll discuss the nursing process and clinical judgment, two fundamental skills every nurse needs to master for providing excellent patient care. Let's break it down step by step. The nursing process is the foundation of everything we do as nurses. It's a structured way to think and act to ensure we provide the best care possible. The steps of the nursing process are easy to remember with the acronym ADPI. Assessment. This is where you collect all the necessary data. You observe, ask questions, and perform physical exams to understand the patient's condition. Diagnosis. Here's an important point. Nursing diagnosis is not the same as a medical diagnosis. A medical diagnosis is made by a physician and identifies a specific disease or condition like pneumonia or diabetes. A nursing diagnosis, on the other hand, focuses on how the patient responds to their health condition. For example, if a patient has pneumonia, medical diagnosis, a nursing diagnosis might be ineffective airway clearance related to excessive mucus production. Nursing diagnoses help guide the care we provide and focus on the patient's needs rather than just the disease. Planning. After identifying the problem, set clear goals and plan interventions. These goals must be SMART, specific, measurable, achievable, relevant, and time-bound. For example, the patient will report a pain level of 3 out of 10 within 1 hour after receiving prescribed analgesics. Another example, the patient will demonstrate correct use of their incentive spirometer within 24 hours to prevent post-operative complications. Implementation. This step is where you take action. Whether it's giving medication, educating the patient, or performing procedures, you're putting the plan into motion. Evaluation. Finally, you check if the goals were achieved. If not, you adjust the plan and continue the cycle. This adaptability is what makes the nursing process so effective. Now, let's connect the nursing process to clinical judgment. Clinical judgment is how you apply critical thinking to make sound decisions throughout the nursing process. It involves 4 key steps. Noticing. Pay attention to changes or signs in the patient's condition. For example, is the patient's skin unusually pale or cold? Interpreting. Analyze the data and figure out what it means. For instance, pale and cold skin might suggest poor circulation or shock. Responding. Take appropriate action based on your interpretation. This could mean elevating the patient's legs or notifying the healthcare provider. Reflecting. After you've acted, evaluate what happened. Did your intervention improve the situation? What can you learn to apply in the future? Let's walk through an example to tie it all together. Imagine you're caring for a post-operative patient. Assessment. The patient reports sharp pain in their abdomen at a level of 8 out of 10 and has an elevated heart rate. Diagnosis. You identify acute pain related to surgical incision as the nursing diagnosis. Notice this focuses on the patient's response to their condition, not the medical diagnosis of post-operative state. Planning. The goal is to reduce the pain to 3 out of 10 within 1 hour using prescribed pain relief and non-pharmacological methods like repositioning. Implementation. You administer the prescribed pain medication and help the patient reposition for comfort. Evaluation. After an hour, the pain level decreases to 4 out of 10, but the patient's heart rate is still elevated. This prompts you to revisit the plan and investigate other potential causes. Using clinical judgment, you notice the elevated heart rate, interpret it might be related to pain or another factor, respond by assessing further, and reflect on how to improve care. That's the nursing process and clinical judgment in action. Both are essential tools for delivering patient-centered care and ensuring safety. If this explanation helped you, give the video a thumbs up, share it with your peers, and don't forget to subscribe to Nursing in Me for more content that simplifies nursing. See you in the next video.